After the COVID-19 pandemic originated from China, China once again is witnessing an outbreak of the human metapneumovirus, and the HMPV. According to reports and social media posts, hospitals are overcrowded with affected individuals and a crisis also overwhelmed. Some social media users in fact claim that type of viruses including influenza, HMPV, mycoplasma pneumonia, COVID-19 are all circulating in China at the same time, and are even claiming that China has declared a state of emergency, and however there is no official confirmation to the same. Let's take it point by point. Who is at higher risk given this virus? Young children, older adults and those with weak immune systems are at a higher risk of developing severe illness due to HMPV. The next question being asked: what are the complications of HMPV? Sometimes HMPV viewers can cause severe illness that may require hospitalization: bronchiolitis, bronchitis, pneumonia, asthma, any infection. There are a few complications that may develop. What is the HMPV infection? To begin with, let's break down these details. The infection is caused by human metapneumovirus, causes symptoms similar to the common cold that are something you can watch out for. It can sometimes cause pneumonia and bronchitis, as well as children and older people can get severe symptoms as well, so they need to be a little careful. It also spreads through coughing, sneezing, and shaking hands, so human touch is something that can get you to be a victim of the same. Touching door handles and keyboards can also cause this infection. In fact, no specific treatment and vaccine is available to treat this virus immediately, and limiting the spread is the only way to tackle this disease. Some more questions have been answered for you. The question that is commonly being asked: has the duo declared an emergency? Till now the answer to that is emergency related to the spread of this virus in China, and the rest of the world has been declared as yet, and there is no official data that indicates a pandemic situation so far. The next question being as to: has the virus been detected outside of China as yet? And the answer to that is that it has been detected in countries like the United States, Canada, parts of Europe and some other nations as well. The next big thing being seen as what are the symptoms of this new virus? The answer to that, like I said, symptoms are cough, fever, nasal congestion, shortness in breathing. Worst of the symptoms may also include problems like bronchitis and pneumonia. And when do the symptoms show, and what is the incubation period? Here is the answer to that is, as experts say, a person will like to experience symptoms within 3 to 6 days after contracting the infection. They are also questioned, being asked on what are the preventive measures of the HMPV infection. The answer to that: wash hands with soap and water, use alcohol-based sanitizer. If soap is not available, avoid touching eyes, cover your nose and face, cover your nose and mouth while sneezing and coughing. Wash hands after touching door handles, workstations, boards. Also wear masks when people around you are not keeping well. Apart from this, the National Center for Disease Control and the NCDC, which falls under the Union Health Ministry, are here in India closely monitoring the respiratory infections and seasonal influenza cases. We will continue to monitor the situation closely. Last week, in fact, China Disease Control Authority also said it was piloting a monitoring system for pneumonia of unknown origin with cases of some respiratory disease expected to rise through the water. Recent cases detected include pathozyme metapneumovirus, with cases of the virus among people under the age of 14 showing an upward trend, especially in northern provinces. And that is why it is a worrying sign. Not just in China, but the neighboring nations and the rest of the world are also closely watching for all these symptoms.